This is urinary catheter discontinuation. So the first thing I'm going to do is I'm going to confirm the order. So Jerry Batch, he's allergic to provolone iodine, which is betadine, and he has an order to discontinue the catheter. So that is confirmed. So now I'm going to gather all my supplies. So I have all my supplies right here. And now I'm going to introduce myself to the client. Knock, knock. Hello, I'm Amanda. I'm going to be your student nurse for today. I'm going to perform my hand hygiene. Can you please tell me your name and your date of birth? Jerry Batch, 6/16/19XX. Are you allergic to anything like latex, adhesives, or betadine? You're allergic to betadine? Okay. So now I'm going to provide my hygiene. So your doctor has ordered for your catheter to come out. Do you have any questions? No? Okay. So now I'm going to perform my appropriate assessments. I'm going to do a GU and an integumentary assessment. It's okay if I can lift up your gown and take a look at your catheter and all that? Yeah? Okay. So for my GU assessment, I'm going to ask him about pain. So do you have any pain related to like your catheter? No? Okay. Are you having like any burning in your penis area when your urine drains into the catheter? No? Okay. So now I'm going to palpate his bladder. Okay. So I don't feel that it is distended, so that's good. And now I'm looking at his skin, so I don't see any signs of infection like edema or mucus or just like redness. His skin is clean, dry, and intact, so that's good. Okay, so now I'm going to empty out the catheter bag. I'm also going to put him in a position for when I take it out, his catheter. Okay, so his knees are slightly bent and feet are pointed out. So now I'm going to drain all the residual urine into the catheter bag, so there's no urine left in there. And now I'm going to empty out the bag. I'm going to measure and document the urine. So I do see that there's no sediments in the urine. There's no foul odor, and it's not very concentrated. It's light yellow, translucent, and no like abnormalities like the sediments and any like pus in it or anything. Okay. Well, I'm going to empty this out in the client's bathroom, and I did use a cylinder that was marked with the client's name and their location in the room. So I do see here that's around like 125 mLs. I will document all of this. Yeah, I'll be measured and documented. I left that in the patient's bathroom. My gloves. I'll perform my hand hygiene. When I take out your catheter, I would like for you to take a deep breath and then exhale, and as you exhale, I will pull out the catheter. This isn't supposed to cause any pain, so if it does, let me know. Raise your left hand, and I will stop. Okay. So now I'm going to place a absorbent pad for hand his feet are slightly bent and pointed out a little bit. Okay. Now I'm gonna drain all the water from the balloon. Around 5 mLs for the first round of that. Okay, so 5 plus 1, so 6 mLs is in the bag. Okay. If I feel resistance when I pull it out, I will stop. Since this is a mannequin, plastic on rubber or rubber on rubber, there might be some resistance, but a real person, if there's resistance, I won't continue pulling. Okay, take a deep breath and exhale. Okay? Alright, 1, 2, 3, take a deep breath, and now exhale. There we go. Okay, so now I am observing the catheter. I'm looking for like any mucus, any blood, any like visible signs of infection. It's intact, so that's good. I'm now going to dispose of this in the appropriate receptacle, which would be a biohazard bag. I'm also looking if there are any visible signs of trauma. Would you like pericare? Yes? Okay. So I'm looking at any signs of trauma on his penis. I don't see any bruising or bleeding. There's no like foul odor, and his skin is clean and intact. Okay. This will go in the dirty linen. I will dispose of this. Take off my gloves and perform some hand hygiene. Okay. Alright, do you need anything right now? No? Okay. I'll replace the gown. His bed is in the lowest position. His call light is within reach. The bed is locked. That's locked. I'm gonna quickly, I would wash the bath basin and put it back to where his shower is. And all that. I'll put in his shower. Do you need anything? No? Okay. So your table is within reach. That bed lock is locked. And this bed lock is locked. 2 of the side rails are up, and now I'm going to sanitize my hands before I leave. And now I'm going to document everything that I did. My skill is complete.